When someone calls 911, a coordinated chain of life-saving events begins, many of which most will never see or understand. The question I pose to you today is, would you know what to do if someone were to collapse right in front of you? Emergencies can affect anyone, can happen anywhere and at any point in time. Knowing what to do and what to expect afterwards can make a critical difference in their patient's outcome. My name is Ben, and I've worked as a critical care paramedic and firefighter for over 20 years now. Currently work in a hospital-based EMS system, and tonight we're going to explain what happens before the lights and sirens. Understanding when to activate 911, when to call, what to do before EMS arrives, and what paramedics do once on scene can help improve emergency outcomes and even save a person's life. Tonight we're going to explain everything that's just been exposed and what happens after we take over. So let's start with the first step in any emergency, deciding whether or not it's time to call 911. That decision today can literally mean the difference between life and death. So recognizing true emergencies can help prevent a delay in care. You should always call for chest pain, shortness of breath, difficulty breathing, signs of a stroke, severe bleeding, or somebody who's unresponsive. And according to Mayo Center clinical staff, knowing when to call is critical for a timely and appropriate emergency response. If you're unsure, it's safer for you to call and let the dispatcher assess the situation. In many cases, they will guide the EMS response and may give you life-saving instructions. They'll prioritize our calls based on severity and can provide CPR coaching and other first aid devices to bystanders. Making that call is just the beginning, however. Believe it or not, what you do next before we even get there can be just as important. Let's talk about some of those steps you can take during those first crucial moments. Before EMS arrives, your actions in the first few minutes can be life-saving. Beginning CPR if the person is not breathing and has no pulse is one of the first steps that we always assess for. The American Red Cross will emphasize that early action by bystanders significantly increases patient survivability and outcome. You, on the other side, can provide care to control bleeding with direct pressure and elevate the arms or legs if it's safe to do so in that event. We ask that you make the scene safe for us before we even arrive. You can do this by unlocking doors, moving obstacles such as furniture, and taking your pets and placing them in a locked room. If it's possible, have someone meet us at the door and bring us in. If you can, gather important information to help pass on to us once we arrive. Some of those things can include a list of medications, their allergies, and any medical care. Those will all help us guide patient outcome and patient care today. A timeline of what's occurred from the beginning to where we're at right now is also very helpful. So by the time we've arrived, a lot's already gone on. But here's where our role kicks in. Let me show you what we bring to the table and how we keep the momentum from going the moment we step in. Once we've arrived on scene, we bring advanced care to the patient's side. What you see in front of you are similar devices and similar equipment that's available in almost every ALS ambulance unit that responds to 911 calls and what's available in a hospital environment. We have the LifePak 15 monitor to assess the heart rate and rhythm and any important vital signs. We can start your IVs, give medications, and manage your person's airway. Every tool and medication we use is used with urgency and accuracy. Some of those things include epinephrine for anaphylactic shock, nitroglycerin for your chest pain, and ventilators for respiratory distress. According to Mistovich and Karan, pre-hospital providers are trained to rapidly assess, stabilize, and initiate life-saving treatments in the field well before hospital arrival. The National Association of Emergency Medical Technicians explains that paramedics, such as myself and others, are trained to deliver critical care interventions well before the patient even arrives. Medications and procedures can vary depending on the emergency that we present with today. Communication with the receiving hospital also begins in the field. While we'll call the hospital and alert them to the patient's condition, any treatment, and our ETA. This coordination of efforts speeds up further treatment upon arrival. So let's finish with a few final thoughts about the importance of what we've done here today. We've covered when to call 911, what to do while waiting for EMS, and once the paramedics arrive on scene, what we're capable of doing. Emergencies are unpredictable, but being informed and prepared can turn fear into action and uncertainty into readiness. Thank you for attending.